I'm excited about it, but at the same time I'm nervous about it. I trust this office, and I trust Dr. Budnick and Dr. Parker and the staff, but I'd be lying if I was to say that there was no butterflies.
I'm a cosmetic surgeon that does in-office liposuction while the patient is awake. Right now I'm going to be numbing up the port of entry sites, so you're going to feel a little prick and burn. And this procedure has come a long way over the last 20 years, where now we're doing it in the office, which makes it actually safer. How was that? Was that too bad?
No, I mean it burns, but it's not unbearable.
Because all the complications arising from it were mostly from the anesthesia. What you do is you come into the office the day of surgery. You can eat a light meal before you come in, some toast, some juice. You come into the office, we give you 2 pain pills and generally a Valium, Ativan, or Xanax to offset your anxiety a little bit about the procedure and the excitement of having it done. And we mark up your area that we're going to liposuction with a marker, and then we lay you on the operating room table. We temess your area that we're going to suck the fat out of. Not too bad though, is it, Drew?
No.
A liter of normal saline with some lidocaine to help numb the area. We also put some adrenaline in for vasoconstriction, so it offsets the bleeding. And we fill up the area with this solution, and the procedure of numbing it up is relatively painless because we put sodium bicarbonate in the solution. Patients rarely complain.
I don't want to say it's filling up, but I can feel the fullness on my left side.
Like Thanksgiving?
No,
or not that kind of fullness?
No, it's like swelling.
And then we put a suction catheter in, and that suction catheter then sucks out the emulsified fat. As we get more fat and we get closer to the muscle, sometimes there's a little bit of discomfort, but I'm communicating with the patient all along. How uncomfortable is it on a scale of 1 to 10?
10 being worst, it's a 3 every once in a while. Wow.
I'm asking the patient, whenever you feel a little pain, to say ouch. Rarely happens, but sometimes they'll get a little jab feeling. And mostly it's a surprise feeling, because the surprise is that there's very little discomfort in this procedure.
Feel good? Not in pain? Actually kind of bored. I don't know where to look. I don't know what to do. I feel like I should be doing something, but just not in pain. Little tiny bit of discomfort every now and then, but I'm just hanging out, really.
They can drink water or have a snack during the procedure. This one patient, she came in, she bought dinner or lunch for everybody, and there was even these little ribs that she had there. She smelled the ribs because the order came during her procedure, and she actually asked to have some ribs during the procedure. So we let her snack on 2 small ribs during the procedure.
But I'm comfortable. I'm just not anything but comfortable.
The recovery time is remarkable. Most of our patients go home. A lot of them have talked about going to a restaurant that day. They have to avoid real heavy lifting, but they can lift up to 20 pounds right away. They can go back to work if they don't have a laborious job, and it's a relatively good procedure.
Just looking down, there's less there than there was before. But it goes back to really what Dr. Budnick has said all along, and it's, you know, there's stuff that just dieting and exercise won't do. Our bodies change, and at 40 I see more of those changes, and I want his help.